And we're back. Welcome to Focus and Flow Lectures. Today we will be going over the respiratory objective assessment, and this is part 1. What is the purpose of the objective assessment? So the clinician needs to collect quantitative information, so you need to know the standard ranges of each body system, and this will inform you whether or not each system is working efficiently and effectively or functioning correctly. You also want to look at the patient holistically, so you want to observe the patient in a holistic manner. So you want to look at their anatomical system or their body systems, but you also want to include their mind or their thought processes. How are they reacting? Are they confused? And you want to look at the social situation. So what's their home life like, and how is that impacting them at this time? The information that's gathered. So it's not only respiratory information that's gathered, there's also cardiovascular system. You want to look at the renal system and the CNS or the central nervous system. Now we're going to look at the ABCDE approach or assessment. A is for airway. Is the patient breathing on their own? You want to think and look at, is the patient having difficulty breathing? Is it because something is obstructing the airway? Are they having stenosis of that airway or narrowing? Or is there something internally going on that we cannot see and we want to just notify the patient's physician? B is for breathing. What is the patient's respiratory rate? But what is respiratory rate? So the respiratory rate is the amount of times that the chest rises and falls, or the amount of times that the patient inhales and exhales within a 1-minute time frame. Auscultation. So you want to auscultate with the stethoscope both anteriorly and posteriorly on the chest. Listen for any vesicular sounds, so that's normal breath sounds, or you want to check and see if there are any adventitious sounds, which are abnormal sounds. And these abnormal sounds, for instance, can be like stridor or crackles, fine crackles, coarse crackles. Cough. Does the patient have a cough? Are they able to produce a strong cough? Is this cough wet and productive, or is it wet and unproductive? Is it dry and productive, or is it dry and there are no secretions at all? SpO2, so this is the oxygen saturation. You use the oximeter and you check the patient's oxygen set, so between 94 and 100 is what we're looking for, unless otherwise specified by a physician. So you want to observe the chest, so you can do some palpation. Do you feel any fremitus? And also you want to just put your hands laterally and then just check the rising of the fall. Is there equal expansion of the patient's chest? C is for circulation. You want to check the patient's hands. Do they look how they normally would? Or is there any cyanosis of the hands, which means that the circulation is being affected and it's not circulating appropriately? Blood pressure, you want to check, is it high, is it low, or is it within the normal parameters of blood pressure? And then you want to look at heart rate. Are they tachycardic, are they bradycardic, or do they fall within the 60 to 100 beats per minute? Disability. Is the patient alert and oriented ×4, or are they confused and they do not know where they are or what happened to them? Next, you want to look at the environment. So any attachments that the patient may have, such as a catheter, a Foley catheter. You want to look at IVs or anything else that they may have attached. Is the patient ventilating? Are they self-ventilating or are they on a ventilator? And which mode is the ventilator on? So over here on the right hand side, I have an infographic of the NIV modes, and these are the 4 of the 6 modes that are available. What is NIV? So the NIV is non-invasive ventilation. We have NIPPV, which is non-invasive positive pressure ventilation. Next, we have the SIPAP, which is usually used for infants. I'm not sure too much about that. I just know that it's for infants. And then we have the NCPAP. So that's the nasal continuous positive airway pressure. So, does your patient require nasal CPAP or do they require facial CPAP? You want to take all of this into consideration when observing the patient on assessment. Oxygen saturation. So what FiO2 or fraction of inspired oxygen is required? So here beneath this we have a table and it shows you the oxygen flow, so liters per minute, and then on the right hand side we have the approximate FiO2 or fraction of inspired oxygen that is being provided. So for room air it's actually 21%. And if they're on 1 liter per minute, it's going to be 24%, 2 liters per minute, 28%, 3 liters per minute, 32%, 4 liters per minute, 36%, and so on. So you can have a look over the table and just review it. Oxygen requirements. What is the patient's oxygen demand? How is the O2 being administered, or the oxygen being administered? Is it via nasal cannula or non-rebreather mask, etc.? Is this the patient's normal oxygen requirements? And are there any abnormalities? And you want to look at what are the reasons for any abnormalities in their oxygen requirement. Blood gas analysis. Are the blood gases within the appropriate range, or is the patient in type 1 or type 2 respiratory failure? You want to consider alkalosis and acidosis. Is there any blood gases that show metabolic or respiratory failure? And then is there any evidence of compensation in their respiration? And this you'll all be able to see from the analysis of the blood gases. Here are the references: Landry 2025, we have Resuscitation Council 2015, and we have the University Hospital Birmingham NHS Foundation Trust. Thank you guys for watching. Please like, share, and subscribe. Tune in for part 2 of the respiratory assessment next time. Thank you.